Mr. Nazim is the secretary with Maldives Family Foundation since 2016. He is also a member of National Advisory Council, member of Maldivian Red Crescent August since August 2009-10. He was elected chair of Maldivian Red Crescent for the first General Assembly since 2010 and elected representative of Maldivian Red Crescent Formation Working Group. So I am pleased to welcome you, Mr. Maldiv, Mr. Nazim. Please, over to you.
Thank you, Dr. Rana. Thank you, the organizing committee for the conference. Okay, my slides. Thank you. Maldives Family Foundation from 2016 have been working towards the domestic livelihood of Maldivian families rather than tobacco. But we moved towards tobacco back in 2018, late 2018, due to the fact that the president was really interested in working towards anti-tobacco. So that's why when we started a campaign called, next please, a campaign we started called I Am Against. This was against passive smoking. We collaborated with 50 NGOs. We requested Ministry of Health and its HPA organ to help us formulate the meetings and whatnot that was to be done to organize such a phenomenal thing. We had a 7-member committee selected and we started off with a public rally. Thank you. Next. These were some of the activities that we conducted. The 50 NGOs, along with the Ministry of Health and HPA, formulated this. We had a public rally. We also had dialogue, organized, scheduled dialogues with all the government ministries, all the large public companies which had government share and some of them not, large private corporations as well. And we also contacted individual regional heads of HPA. HPA is the leading tobacco control organization in the Maldives. There are no other private or government organizations working against tobacco except us now. So we contacted the regional heads, HPA, and we held information exchange sessions. We had lawyers working with us that would inform government officials that what is allowed within government premises, that you can smoke in the premises or not. It was a wide practice in the Maldives, especially in the atolls, because we are very, very distributed over the ocean. We are distributed far places, and the government officers there, they do not abide by the regulations. So we had to coordinate all of them individually and bring all of them onto one platform. So now all of them are aware of all the laws. After that, we started working on a petition especially against passive smoking. We wanted people to stop smoking on the streets. Male is very crowded. It's one of the densest cities in the world. We have got about 450,000 people in the Maldives, the whole country, whereas about 150,000 people live on one island of 2 square kilometers. If you can imagine that, you will know smoking on the street will be very, very difficult for the next person walking on the street. So we started this campaign, passive smoking, and we collected over 20,000 signatures from the city and other islands. We are still working on signing the petition. Since this project is quite young still, we plan to submit the petition over the next 1 year or 2 years. We also held, please go back. We also held TV programs, radio programs, and panel discussions with different state media. And during the COVID phase, we campaigned through social media. While in lockdown, we made announcements and many public contacts through social media. We also engaged HPA. We spoke to HPA because HPA was sending mass number of messages relating to COVID. So we embedded a message that we should include something about tobacco as well. So they did help us, and we were able to use their SMS to incorporate our anti-tobacco slogans into the messages. Next, please. These are some of the things that we plan to do over the next 2 years. The petition, we need to submit that and get things coordinated. The next project we will be working on soon will be attending to the current laws towards passive smoking, to orient it more towards passive smoking. We will be hiring lawyers and working with them towards amending the laws and proposing it to the parliament. We are also pipelining a self-help portal for those who quit smoking. That's why I commented for an earlier presentation that we were also working towards such a thing. So if they could share, that will be an excellent add-on for us as well. And then we are working with Empower tools as well for the next 2 years. Okay, next please. Next slide. Yeah. So these are some of the facts about the Maldives. Currently, this is from 2018 records that we could get hold of. Later records, some of the records are updated here. Majority of the references here are from 2018. 193 deaths are related to smoking. That's 15.3% of deaths per year related to smoking. Males, just about 20%, females, 8%. There is 42.4% male smoking percentage in the 15 to 49 age range. Our initiation age is just before 18 years. Our total imports for 400,000 people is about 462 million sticks. That's about 1,000 cigarettes per capita import. We've got $6.48. That's like Maldivian rupiah, 100 rupiah. Per pack, per 20 stick pack. 39% of smokers say that they want to quit, and there is a reported 33.5% health workers advising their patients to stop smoking. Currently, there is another graph that I've put in there just for your information. If you have the time, you can go through that. I'm not going to go through that. There is in our Constitution, every citizen is granted the right to a clean environment. And the government is bound by the parliament, by the Constitution, to use whatever in its capacity as the resources allow to accommodate this to its citizens. So we are going to be working towards using these Constitution clauses when we work towards anti or passive smoking. Ministry of Health is actually in charge of anti-smoking, everything to do with anti-smoking in this country. And Ministry of Health has Health Protection Agency, which is working quite favorably towards tobacco control in the past few years. I will show you some facts from HPA's works over the next slide. Thank you. Next. Okay, these are some of the work that Health Protection Agency, HPA, has done over the past few years. We have got cessation centers all across the country. Every major hospital has cessation centers. There is specific for cessation centers across the country, specifically for cessation. We have already packaging compulsory. 90% of the pack should be covered with graphic label warning. That is after the amendments over the past 2 years. We have got a tax percentage which is different for sticks and weighted tobacco. 70% is the average per stick. There is a fixed amount. Okay, I should quicken up. Okay. We have got smoke-free areas, non-smoking areas as well. There currently private offices and restaurants. Restaurants are partially restricted. They are allowed to have smoking areas specifically. A lot of work has been done by HPA using the Empower tools as right on the right side of the slide. As you can see, 100% indoors is banned. Monitoring is quite rigorous now. We have got all importers registered, all dealers registered. We've got GYTS, STEPS, and DHS in place. No loose sticks are being sold. All direct and indirect promotion, sponsoring, freebies, everything is banned. Yeah, so that's about it. Next slide. Yeah, thank you so much.